Parkinsonism is a symptom complex composed of 4 different cardinal sets of signs and symptoms. The first of these is tremor. Tremor is an abnormal involuntary movement which consists of alternating rhythmic involvement of the agonist and antagonist at any one joint. This gentleman demonstrates tremor of both upper extremities, both lower extremities, and his jaw. The tremor of Parkinsonism is characteristically present at rest and ameliorated, at least in part, by the initiation of purposeful movement. Although tremor is perhaps the best known of the signs and symptoms of Parkinsonism, it is not invariably present. The presence, however, of a rest tremor like this is pathognomonic of Parkinsonism. Here we see the tremor of both hands ameliorated by the initiation of purposeful movement, and the recurrence of the tremor after the hands rest on the knees. This is the classic rest tremor of Parkinsonism. Throughout these hand motions, the tremor of the jaw persists. Akinesia is the second of the cardinal signs and symptoms of Parkinsonism. Akinesia refers to difficulty in initiating and carrying out purposeful movements. The term bradykinesia or hyperkinesia are also used, but are really synonymous with akinesia. Here we have the same gentleman having difficulty initiating standing from a seating position. The same patient with his rest tremor initiating gait. Steps are small, shuffling. Turning is accomplished with many small steps. Again, initiates movements with slow, small steps. There's also a lack of swinging of the arms, what is known as decreased associated movements during walking. Again, the small shuffling steps of a Parkinson patient. Another manifestation of the akinesia of Parkinsonism is the masking of the facies. Here we have a gentleman with a masked facies with almost no expression and none of the normal play of expression that we see on a normal face. He also tends to stare without blinking, a phenomenon known as a reptilian stare. The third of the cardinal signs and symptoms of Parkinsonism is rigidity. Rigidity is defined as an increased resistance to passive movement, which is approximately equal in the flexors and extensors and is present throughout the entire range of motion. If it is as if a lead pipe is being opened or pulled upon, it is called lead pipe rigidity. If the rigidity is such that it is as if the muscle is being pulled over a cogwheel, it is called cogwheel rigidity. Here we have definite cogwheel rigidity on the right arm of this patient with increased resistance and a jerky cogwheel-like motion. The last of the 4 cardinal signs and symptoms of Parkinsonism is the loss of postural reflexes. Patients do not respond normally to a threat to their posture. Here we have our patient pushed back slightly and responds with retropulsion or many backward steps. Again, the same type of phenomenon, although this patient did not